Okay, good afternoon. I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. A reminder, after the pep talk, please take the online learning com evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown here. I placed the link in the chat box. Another reminder, obtaining 25 OLETE certificates will entitle one mentee to a voucher for a ROJoson medical consultation, free medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 1 to 2 minutes. Everybody's on the... Ito na. Okay. And then, want to show your face? Okay. One. Wait na. Okay, ready? One. Wait. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I have been tackling health disorder and health issue courses. May 18, 2024 marks the start of year 4 of the ROJoson PEP Talk. How long the PEP Talk will last will depend on the enthusiasm, discipline, and perseverance of everybody. You and I. Okay. My PEP Talk today is entitled Medical Anecdotal Reports Correcting an Error in Breast Ultrasound Diagnosis. The empowerment objective is for the lay people to have an essential understanding on the process of correcting an error in breast ultrasound diagnosis as part of your health management, as part of our empowerment program. The contents of this pep talk will be, I will present the definition of medical anecdotal report, a very short definition, and then I will have a narration of the event or the case or the patient, and then I will have an insight, and reflection. So the title of the MAR will be Correcting an Error in Breast Ultrasound Diagnosis. The content of this pep talk will include my thoughts, perceptions, opinions, and recommendations culled from personal experiences and writings of other professionals, especially on the reflections. Here is the summary or a gist of the MAR. A 75-year-old Filipina, 1 year post-stroke, consulted me on January 23, 2024, so early this year, for a breast mass noted 2 weeks ago. Before she came to see me, she noted a breast mass. There was a dominant solitary, solid left breast mass, about 1.5 centimeter in size, with ill-defined border, for which my primary diagnosis was a breast cancer because of the ill-defined border, and it was solid. But after discussion, she opted for an ultrasound study instead of a biopsy. So she opted for a ultrasound first, which gave a diagnosis of an island of fat, parang taba lang, for the palpable mass. So we decided to observe because of the report. So, but she did not come back for follow-up. I advised her to come back after 2 months for observation, but she came back after 6 months. The mass at this time was accompanied by slight skin, maliit lang naman, slight skin retraction, which I noticed, for which I strongly suspected cancer. So I had the repeat ultrasound done, followed by a needle biopsy, which showed the mass to be suspicious for malignancy. We then operated on this patient, and in the end, it turned out to be the mass was really malignant. So there was an error in the diagnosis, in the breast ultrasound diagnosis, when they gave the diagnosis of island of fat. So this is the gist of the MAR. Some reflection and learning points that I will be discussing, and also the issues. Can ultrasound of the breast give a wrong diagnosis? Is ultrasound of the breast always 100% accurate? When does a breast surgeon accept an ultrasound diagnosis? When does a breast surgeon start suspecting errors in the breast ultrasound diagnosis? What options are there for the breast surgeons to correct an error in breast ultrasound diagnosis in a timely manner? Para hindi tumagal, para hindi mahuli, timely manner. So then I will give my tips on the management of a similar situation. So MAR, when you say MAR, it's medical anecdotal report. It's operationally defined by myself as a brief written report of an actual medical event, okay, actual case, actual patients that involves an actual true patients. The medical observation must have an impact on the reporter, which is me, in terms of insight gained and which the reporter thinks it's worth sharing with other people, or usually for learning purposes. So sharing with you, okay, particularly because we are in this pep talk. Okay. The MAR will have two parts, narration and then insight or reflections. So let's start with the narration. So I had a patient identified with these initials, ZAL, a 75-year-old female, Filipina, 1 year post-stroke, consulted me on January 23, 2024 for a left breast mass noted 2 weeks prior. On physical examination of the breast, there was a dominant solitary, solid left breast mass about 1.5 centimeter in size with ill-defined border, in which my primary diagnosis was breast cancer. So this is the actual records. Okay, 75 years old, lump on the breast, noted January 2024. Okay, there was this mass on the left side, left upper outer quadrant, which when I palpated it, it felt solid, dominant mass with border, not so well defined, but it was not fixed to the underlying tissue. There was no associated pain. So because of the ill-defined border and because of her age, my primary diagnosis was a left dominant breast mass, most likely cancer. If it's not cancer, no, I'm not 100% sure here. Nobody's 100%, but this is the more likely one compared to to another possible diagnosis, which could be benign. So I gave her the option of ultrasound and biopsy. but she opted for an ultrasound first, okay? So to check whether to study the mass. So she opted for an ultrasound to further evaluate the palpable breast mass. Then I asked her to come back with the results of the ultrasound. So ultrasound report came back. So this is the copy of the report. Very categorical yung mga statement dito. So there was no definite mass seen. Okay. Ito, nakalagay ito. No definite mass. Very categorical. Okay. And then a fat island is seen on the left upper outer breast which correspond to the palpable lump. So yun nakakapan ko at nakakapan ng ultrasonographer. Okay, sinabi ng ultrasonographer, it was just a fat island. Fat island means an island of taba. No? Okay. So, ang conclusion niya, ang impression niya, because it's just a fat island, parang normal lang sa mga babae, a fat island. So, sinabi niya, no abnormality delineated by the ultrasound. Kaya nilagay rin niya as a summary, by RADS category 1 negative. No? So, walang findings, walang bukol, no? Okay. Okay. Because of the tone of the January 23, 24 ultrasound report with definite statements on the fat island and negative abnormal mass, as a clinician, ako yon, I have to accept the ultrasound diagnosis. Kung meron siyang dudang statement, I may have to make another decision, ikakapa ko ulit. Pero yung pagka-report niya, very definite siya, no? Okay, walang kaduda-duda, fat island, negative abnormal mass. So, but despite that, since nothing is 100% certain in medicine, at most hanggang 99% lang tayo, I recommended monitoring. Monitor lang, babalik siya for check-up, no? Either also by monitoring by HERSA, kung lumalaki o may mga pagbabago, may mga changes. So I asked her to come back after 2 months, no? 2 months after. Okay. So ito, back after 2 months for monitoring, fat island, ganon. No? Patient did not come back after 2 months as advised. She came back for follow-up on August 6, same date, August 6, 2024. That's about after 6 months. At this time, I noted a slight skin retraction, signifying the mass was closely adherent to the overlying skin. So may konting changes ako napansin na puna. Okay? Pero yung bukol was still movable. So yung findings ko na yon, slight retraction. So I was I was thinking most likely cancer na ito, no? Okay. So worrisome of the current PE findings, which was the slight retractions. So because of these worrisome findings for the breast cancer, I gave her 2 options: repeat the ultrasound at the same institution, so a comparison and review could be made. And then another option is an outright needle by aspiration biopsy. So, but ang pinili ng pasyente muna, repeat ultrasound of the breast. So repeat ultrasound on August 6, 2024 showed the following. This time, meron na nakitang breast mass with suspicious feature. So at the same area, left side, 2 o'clock, okay, ill-defined, ngayon nilagay na niya, ill-defined, irregular, speculated, okay, 1.3 by 0.09 and by 0.06 centimeter in size. At ang conclusion ng radiologist or ultrasonographer this time was BI-RADS 4 na. Earlier, it was BI-RADS 1, yung first one, negative. Ngayon, it's BI-RADS 4. When you say BI-RADS 4, it's suspicious for cancer. Okay. So with this ultrasound, repeat ultrasound, my primary diagnosis was breast cancer left. So I discussed with the patients with the patient the options for additional diagnostic procedure like biopsy, either a needle or a core on an open biopsy. So she opted for a needle aspiration biopsy. So this shows my explanation, okay, giving her the options biopsy, okay, aspiration, needle biopsy, core needle, or the other one's an open, no, you remove it already, and then after that, do a rapid frozen section and then decide what to do thereafter. Okay. But she opted for a needle aspiration biopsy. So needle aspiration biopsy showed, this was done, it showed atypical ductal cells suspicious for cancer. Suspicious for cancer. An operation, because of this, an operation was planned with a pre-op diagnosis of breast cancer with 98-degree certainty. This is my degree of certainty as a clinician. Now, the basis for or reasons for the high degree of certainty of 98% were the following. I have to explain this to the patient. No? Okay, so sabi ko, needle aspiration biopsy, nag-report may suspicious na o for cancer. And then physical examination, yung sa akin, meron din ako suspicion na baka cancer yung bukol because of the slight retraction. And it's solid, and because of the age, no? Then the repeat ultrasound findings diagnosis, which showed BI-RADS4, which also showed suspicious for cancer. And then the other factor that will make us really suspect that this could be cancer is the age of the patient, 75, 76. Breast cancer is common in this age group. So itong 4 points that will strengthen our diagnosis or suspicious for breast cancer at as high as 98%. No? So a total mastectomy and axillary dissection left was done on September 21, 2024, and the histopath showed invasive carcinoma with negative nodes. Okay. So at 6 months, buti na lang, wala pang nodes. Okay. And then the size is 1.5. Okay. So stage 1 pa lang. Okay. So end of the narration. Now we will go to the, okay, this is the gist. I won't repeat it anymore. Okay. So we will now go to the reflection and learning points and issues. Number 1, can ultrasound of the breast give a wrong diagnosis? Is ultrasound of the breast always 100% accurate? Yes, it can give a wrong diagnosis as illustrated in this MAR. And ultrasound of the breast may have a wrong diagnosis, and it's not always 100% accurate. Okay. Not only for ultrasound, for everything in medicine, even for the physical examination, CT scan, okay, mammography, they're not always 100% accurate. Okay. When does a breast surgeon accept an ultrasound diagnosis? So when there is no marked discrepancy in the ultrasound and clinical findings or clinical diagnosis, when they say clinical, yung history saka yung physical examination with more emphasis on the physical examination, and there is no suspect or inkling that or hint that the ultrasound diagnosis is wrong. Okay. So in this particular case, very categorical ang statement niya, kaya naniwala naman ako, no? Okay, wala naman siyang mga statements na suspect siya or suspicious for something or doubt. We commit doubt, wala, no? Okay. So, and it's possible to have such a fat island in this age group. Pwede rin, no? Kaya lang, it's not very common, no? So, in this MAR, my primary diagnosis of breast was breast cancer on January 23, 2024 before the ultrasound. My only basis for suspecting cancer was the ill-defined border of the mass. The degree of certainty was thus low, just 60 to 70%. Kasi ill-defined border lang ang basis ko. Kung yung may skin retraction, tataas, no? Baka 80%, no? Kung merong kung fixation, hindi gumagalaw, tataas pa, baka 90% na. Pero sa kanya, at that time, yung pagkapa, yung border, hindi siya masyadong malinaw lang. Kaya that could be used as a basis to suspect cancer. Pero ang degree of suspicion, hindi siya mataas, no? 60 to 70% lang. And then, because of the tone of yung tono ng radiotherapist, yung ultrasonographer, so with definite statement on fat island, hindi lang yun describe kung ano yung border noon, yung mga ganon, no? Basta mayroon siyang categorical statement na fat island na kagad. And then sinabi niya walang negative abnormal mass, no? So as a clinician, I was led to accept the ultrasound diagnosis. So when they say led, mistakenly led, okay? So in retrospect, no? Nagkamali ako, no? I was mistakenly led by the ultrasonographer. Okay. So although a fat island is rare, sabi ko sa inyo, pwede, it can exist. Also, the ultrasound is a tool that can more easily recognize a fat island than my physical examination. Okay. So if we were to compare yung advantages and benefit ng ultrasound versus yung kamay ko, yung kapa, mas maraming information makikita sa ultrasound. Yeah, I just have to give the ultrasound the benefit of the doubt na mas accurate siya. Okay. And then beside, the ultrasonographer was so definite, walang slightest kaduda-duda, walang doubt. Kaya ako'y nadala. Kaya I was just misled, no? And then the other reason for this is that a fat island can present with the same physical examination findings that I elicited. Yung findings ko pwede ding the same as the findings of the fat island on ultrasound. Okay. So there was no marked discrepancy in the ultrasound and physical examination findings, and I had no inkling or hint that the ultrasound diagnosis was wrong. Okay. As I said, with definite statements on the fat island and negative abnormal mass, as a clinician, I was led to accept the ultrasound diagnosis. So, but in retrospect, I was mistakenly led to believe the ultrasound diagnosis. Mali pala. Okay. So, in retrospect, I did not question, which I should have, the lack of detailed description on the so-called fat island. So there was no mention of the size, no mention of the quality of the border, no mention of whether it's solid or cystic. Wala siyang the usual mga ginagawa ng mga ultrasonographers. Once they see something, they describe the size, the border, and other features. No? Dito sa pasyente nito, walang nakadescribe. No? Kaya kung may nakadescribe, I might have the opportunity to study the characteristics and then make a decision kung talagang tama yung diagnosis niya. No? So I gave the ultrasonographer the greatest benefit of the doubt. However, I had still some reservation, believing that there's no such thing as 100% correct all the time. So I advise monitoring to the patient. So self-exam and then check up after 2 months. So imo-monitor ko lang. Baka mali din, no? Okay. So when does a breast surgeon start suspecting errors in breast ultrasound diagnosis? As I said, when there is a marked discrepancy in the ultrasound and the clinical diagnosis, yung findings ko and the ultrasound, malaking discrepancy, and there is no inkling, wala akong kahint-hint na mali yung ultrasound diagnosis. So that's the time that the breast surgeon should start suspecting errors. So in this patient, when she came back for follow-up on August 6, that's after about 6 months, I noted a slight skin retraction, signifying that the mass was closely adherent to the overlying skin. So this finding was worrisome for breast cancer already. No? I mean, naka-note ito, worrisome at the current physical examination findings, which is the slight skin retraction. So follow-up is very important in detecting errors in earlier diagnosis, whether ultrasound and clinical, and whether from ultrasonographer or from the breast surgeon. So as I said, walang 100% perfect accuracy in all things. No, importante yung follow-up check-up, no, by both especially by the breast surgeons. No, okay. What options are there for the breast surgeons to correct an error in the breast ultrasound diagnosis in a timely manner? When you say timely manner, parang hindi mahuli. Kasi kung let's say yung naging breast cancer nga ito, makapagbalik niya 6 months after, yung pala naging 2 centimeters, 3 centimeters, medyo mas malala na, no? Okay, or mas advanced na. Okay, so we want to avoid that delay in the diagnosis, no? Okay. So kung mali ang diagnosis at the very start, no, pwedeng lumala yung cancer niya when they come for check-up, no? Kung masyadong matagal yung follow-up period, no? So what options are there for the surgeons? Surgeons will decide on the various options available in consultation and with the informed consent with the patient and relatives. So a particular option is chosen based primarily on cost effectiveness. So yun sa kanya, I discussed with the patient, sabi ko, balik ka after 2 months. No? Because I don't expect that any changes will occur, significant changes will occur within 1 month. No? So sayang yung bayad niya sa akin kung babalik siya after 1 month pero wala namang makikitang changes. No? No, but to back that up, pwede mangyari after 1 month na baka may lumaki. No? So I asked her to do self-palpation, kakapain din niya on her own, no? So dalawa yon, no? So the most important thing to do is to correct the error in the ultrasound diagnosis that is suspected to be present as soon as possible. Yes, sabi ko, after 2 months. After 2 months is reasonable na, no? In this patient, upon discovery of the error of an ultrasound diagnosis, I gave her 2 options. Repeat ultrasound of the breast at the same institution so that a comparison and review could be made, and then needle aspiration biopsy. So she opted for a repeat ultrasound of the breast first. Then this was followed by a needle biopsy. So at this time, the error was corrected. No? So nung ginawa namin repeat ultrasound, then after that, a week after, we did the needle biopsy, na-correct na namin kagad. No? Okay, within 1 to 2 weeks. Within 2 weeks. No? So what are my tips on the management of a similar situation? My advice for the patients, so be wary of the possibility of errors in breast ultrasound diagnosis. Kadalasan kasi ang mindset ng mga pasyente, palaging perfect yung mga they trust, ang thinking nila perfect yung mga reports na nanggagaling sa mga X-ray, mga CT scan, laboratory, etc. Okay? So walang 100% perfection dito. Even mga doctors, yung mga physical exam ng doctors, wala ring 100% perfection. So important here to be vigilant against this possibility of errors with the help of an expert breast surgeon specialist. Importante yung breast clinicians dito, no? Pag may mga possible errors sa ultrasound diagnosis, importante yung breast surgeon to come in, no? It is important to have a follow-up, and the keyword here is follow-up. Palaging may follow-up, check-up. So follow-up, check-up, okay, with a short interval, depende sa decision ng analysis ng surgeon, pwedeng mas matagal, pwedeng mas maikli, no? So mas importante may follow-up. So this is to detect and be vigilant against errors in the breast ultrasound diagnosis. The expert breast surgeon specialist will provide guide and advice on the intervals of follow-up. But once na-advise ng breast surgeon, let's say 3 months, 2 months, 6 months, now this has to be religiously followed by the patients. Okay? Unless gusto ng pasyente, marunong siya, kumapa ng sarili niya. Na? I guess, wala namang pasyente na expert sa breast kapaan. Na? Okay? Yung surgeon pa rin ang pinaka-reliable person to go to. No? Now, my advice for the breast surgeons naman, yung mga colleagues ko, no, yung mga kapwang doktor ko, be vigilant against errors in breast ultrasound diagnosis. So, scrutinize the reports, correlate with the clinical findings, talk to the ultrasonographers as indicated. So, kung may mali, kung may duda, may kausapin ng ultrasonographers. And then always have a follow-up scheme to detect and correct errors that might be present. Okay, ganun din. Follow-up. Importante yun. No? Until you are 99% sure tama ang diagnosis, no? Na wala nang ibang gagawin. No? So, I have presented a MAR entitled Correcting an Error in Breast Ultrasound Diagnosis. And the gist of the MAR, to repeat, 75-year-old Filipina, 1 year post-stroke, consulted me on January 23, 2024 for a left breast mass noted 2 weeks prior. There was a dominant solitary solid left breast mass about 1.5 centimeter in size with ill-defined border in which the primary diagnosis was breast cancer. She opted for an ultrasound study which gave the diagnosis of islands of fat for the palpable mass. So we decided to observe, follow up, but she did not come back for follow-up after 2 months, but she came back after 6 months. Butit na lang. Kung bumalik siya after 1 year, I don't know what will happen. Okay. So the mass at this time was accompanied by slight retraction for which I strongly suspected cancer. So repeat ultrasound followed by needle biopsy showed the mass to be suspicious for malignancy. So we then operated on this patient, and true enough, after the operation, the histopath showed really an invasive cancer, a cancer. So I presented some learning points and issues and reflections. My reflections: can ultrasound of the breast give a wrong diagnosis? The answer is yes. Is the ultrasound of the breast always 100% accurate? No. When does a breast surgeon accept an ultrasound diagnosis, and when does a breast surgeon start suspecting? If there is a discrepancy between the ultrasound findings and also the physical exam findings, and then there's a parang merong suspecha baka may discrepancy, no? So what options to correct an error? Importante yung scrutinization of the surgeon on the ultrasound report, and also may follow-up palagi. I presented some tips on the management of a patient with a similar situation. So takeaway in relation to patient empowerment: be always in touch with reliable medical information on correcting an error in breast ultrasound diagnosis. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions or make better decisions on management of correcting an error in breast ultrasound diagnosis as part of your health management. This ends my pep talk today. I hope I have empowered you to have an essential understanding on error in breast ultrasound and how to correct them as soon as possible as part of your management. Understanding that it's possible, and then we have to correct it as soon as possible. Reminder after the pep talk, before we go to the QA portion, take the OLETE for Mastery of Learning and have a perfect score to get a certificate like this. I've placed the link in the chat box. And then obtaining 25 OLETE certificates will entitle one mentee to a voucher for a free ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the QA and interactions. Please turn on your video now. Okay. Get set. Get set. Ready? 1, 2, 3. Let me save this first. Okay. The floor is now open for questions, comments, and sharing of experiences, as well as consultation. As I promised, I allow consultations, but be a short consultation lang. The consultation will be just based on mga discussions lang. I cannot do the physical examination on you in this online platform. Okay. So any comments, any questions? Raise your hands if you have a questions, or unmute yourself right away. Anybody? How many has experience having that situation? Nagkamali ang ultrasound. Yung pala, sana yung mali nun, from cancer naging benign. Mas pangit yung from benign naging cancer, di ba? I suppose we have heard of incidents like that. This is just one documented case na share ko sa inyo. Pero siguradong meron dyan, marami dyan. No? Okay. May kilala kayo? Wala?
Hello po, Doc.
Ellen, okay. Go.
Doc, i-share ko lang po kasi po di po ba before pandemic, minomonitor nyo din po talaga ako kasi po may mga breast mass sa both breast ko. Tapos nag-pandemic po. Yung pandemic po, nawalan po kayo ng face-to-face. Nung time po na yon 2021, meron po ako nakapa na parang malaki sa right breast ko po. Tapos iba po yung kirot niya. Since nawala po kayong face to face, lumipat po ako dito sa Bulacan ng ng doktor, yung malapit lang po sa amin. Tapos nag-consult po ako sa kanya, tinuro ko po yung nakapa ko. Tapos pinakita ko po yung breast ultrasound from high precision. Ang sabi po niya sa akin, pero may sukat naman po yung yung mass na sa yung result po. Ang sabi po niya sa akin, wala yan, ribs mo lang yan na namamaga. Sabi po sa akin ng surgeon na napuntahan ko dito sa Bulacan, isang hospital po siya. Tapos sabi niya, monitor lang natin yan, after 6 months, balik ka ulit, laboratory, tapos consultation. Di ganun po ang ginawa ko, parang twice po yon. Pagbalik po, sabi niya, sige, monitor lang. Nung pagbalik ko po, since na yung sa laboratory po nila, yung nakita po na mga before na na mass sa breast ko, nawala po pagdating dun sa hospital nila. Yung laboratory po nila parang hindi ko alam, nawala yung mga breast mass na nakita. Tapos parang twice po ako sa kanya, bali 1 year na po yon kasi twice na 6 months after 6 months. Tapos 2022, iba na po talaga yung pakiramdam ko na mas mas lumalala po yung kirot. Pero nung time po na yon, yun nga, meron, salamat sa Diyos at meron na po kayong face-to-face consultation. Di nagpa-ultrasound po ulit ako para bumalik po sa inyo. Ngayon, sabi po sa akin nung sa high precision, after ng ultrasound makuha mo yung result, balik ka agad sa doktor mo. Tsaka, tapos nung time po na yun ng 2021, 0.5 pa lang po yung yung breast mass dito sa right breast ko. After 1 year po, naging 1.5. Ayun po yun, nung after po nun, nung 2022, yung 1.5. Kaya after nakuha ko po yung result, buti po may face-to-face consultation na kayo. Ayun po, yung sa ano po, suspicious malignant. Kaya pagdating ko po sa inyo, sabi nyo mag-ano yung needle aspiration po ba yon?
Ah,
Hindi nyo pa po natutusok, sabi nyo, eto 80 to 90%. Tapos yung nakuha nyo pa after aspiration, 98 to 100%, sabi nyo po. Siguro po, kung hindi po nag-pandemic, kung tuloy-tuloy nyo pong na-monitor, siguro po hindi po lumala ng ganon sa case ko po.
okay.
Kaya,
Pero
sabi ko,
hindi naman masyadong lumala. Lumaki ba? Mas
kasi po, kung yung 0.5 nung 2021, 0.5 cm pa lang po eh.
0.5 pa lang. 0.5.
Opo, nung nakapako po. Tapos nung pagkahabang naliligo po ako nakapako, iba po talaga na. Before, wala po ako nakakapa.
Ah, oh,
Kaya, ang sa akin po, hindi po nagkamali yung sa ultrasound. Ang nagkamali po, yung doktor po mismo. Kasi
mm.
sinasabi niya po sa akin, ano lang po, wala yan, ribs mo lang yan namamaga. Eh, sarili ko po nakakapako po eh.
Yung ikaw mismo nakakapa mo yung bukol.
Opo, nakakapako po mismo yung bukol. Tapos iba po talaga din po yung kirot.
Tinuro mo sa kanya kung saan mo
Din,
nakakapa.
opo, tinuro ko po sa kanya.
Despite that,
Nagkapakapa din po siya. Pero ang sabi po niya sa akin, ribs lang daw po na namamaga.
okay. And then yung sa ultrasound, anong naka-report doon? Doon sa 2021?
Ano po,
0.5, 0.5.
benign po naman, 0.5, benign. Tapos, nung 2022, suspicious malignant na po.
Okay, 0.5. O sige. So, pwede mangyari yung mga ganon. Even din sa kamay ko, pwede din mangyari. Importante, as I said, hindi tayo perfect all the time, no?
Opo, opo.
Kayo, kung kumakapa kayo, hindi kayo rin sigurado, hindi 100% perfect. Kami rin, as doctor, hindi 100% perfect all the time. And then ultrasound, ganun din, no? Okay. So, kaya yung ultrasound, nakita, minsan nagbabago-bago yung mga reports, di ba? Kahit na
Opo, opo.
repeated ultrasound, iba-iba ang report, no? Kung minsan nalilito na rin tayo, no? Okay. So, kaya importante yung follow-up, palaging monitoring, yan ang bottom line, yan ang pinaka-importante, no? Kung may follow-up on a regular basis, I cannot tell you kung how frequent, pero you can start with your own, yung breast self-exam monthly,
Opo.
no? And then for the doctors, kasi you have to go to the doctors, no? Depende na, no? Kung sa anong degree of, kaya importante yung mga doctor dapat marunong mag-quantitate, no? Kung may how much is the degree of suspicion, no? Or certainty, no? Hindi pwedeng 50-50 palagi, no? Kasi palagi 50-50 ang usapan, no? So sabihin nila kung may suspect ng 60%, pwedeng yung check-up, pwedeng kung may suspect na kahit na 60%, yung check-up will be mas shorter, hindi yung 6 months, di ba? Okay.
Opo, opo, Doc.
Pwedeng 1 month after, 2 months after, gano'n, no? Okay. So as we were discussing last 2 weeks, 3 weeks ago, no, I still have to look for a justification yung frequency of checkup, no? So palagay ko depende na rin sa surgeon, no? Kung gaano katagal yung gusto niya yung i-check up. Baka 2 months, 3 months, yan ang pinaka-safest, no? Kasi we cannot predict kung anong mangyayari sa katawan ng isang pasyente, no? So,
Opo, Doc.
biglang lalaki, yung iba naman mabagal, no? Ganon, no? So safer will be 2 to 3 months ang check-up, no? Ganon, no? So yung sa iyo nung pumunta ka sa akin, meron ng gaano kalaki na yung bukol mo nung pumunta ka nung
Malilit lang naman po, Doc. Ang ano nyo nga po, fibrocystic changes.
okay. And then, okay. So as you said, I've been seeing you for a long time before the pandemic, di ba?
Opo, opo.
So, kaya importante pa rin yung check-up. Walang no such thing as 100%, no? Kaya kung it could be benign, it can stay that way. Pero sa buhay ng isang tao, pwede pa rin magkaroon ng breast cancer anytime, di ba? Okay, as long as we are alive in this world, anything can happen, di ba?
Yes po, opo.
Yan ang hirap dito sa mundo na ito, yung buhay natin, no? We cannot predict what will happen to our life, no? May bago lalabas na hindi natin, kahit na anong ingat natin, lalabas na lalabas, no? Wala na tayong control doon, no? So, importante yung check-up, no? So, but sa'yo, because of your, ikaw rin, you have to be congratulated, religious ka nagpapa-check up, kaya nahuli ng maaga.
Opo.
Okay na yung 1.
Thank you po.
Okay na yung 1.5, 1.5 lobas. Sa'yo.
Opo.
Okay. So, okay na
1.5 po.
pwede lang, ha? Huwag lang yung mga 4 centimeters from 1.5 naging 1.5, walang check-up, naging 4 centimeters, yon talagang papagalitan ka na. Okay. Pero okay.
Thank you po, Doc.
Sige. Thank you also. Thank you for
sharing. Thank you po. Salamat po.
Okay. Thank you, Ellen. Okay. Any more questions? Okay. Meron pa mag-share? We have a new face here, si Oppo CPH 2471. You want anything? You want to ask questions? Ikaw ba, may pangalan na Oppo CPH 2471. Ikaw, di ba? May tanong ka? I-unmute mo sarili mo. Unmute mo sarili mo. Baka may tanong ka. Wala kang tanong? Tanggalin mo yung i-unmute mo yung sarili mo. Unmute. Hindi kita yan. Okay. Good. So, meron kang tanong? Number 1, welcome to our Zoom.
Yes, Doc.
Oo.
Good afternoon, Doc. Meron kasi akong tanong. May nakalagay kasi dito, solid nodule and right breast at the 10 o'clock position, 2 cm from the nipple, measuring 5.46 by 5.26 and 7.36 mm.
Okay. And then?
Tapos dito sa baba, few normal sizes lymph nodes with intact fatty helium are seen in ciliary regions.
Okay.
The largest one in the right measure 6.87 by 4 mm, while the largest one in the left measures 6.76 and by 3.16 mm.
Okay.
Ang nakalagay impression, Doc, dito, consider fibroadenoma, right? By RADS3, probably benign findings.
Okay.
Tapos, unremarkable sonogram of the left breast, normal size, benign, appearing bilateral axillary lymph nodes.
Okay. Number 1, may nakakapa ka ba?
Yes, Doc.
Saan? Kaliwa, kanan?
Sa right, Doc.
Gano'ng kalaki?
Ito yata yung right.
Yung sariling measurement mo. Olen?
Siguro, ma'am.
Santol? Kalamansi?
Parang buto ng santol, no? O kalamansi.
Gaano kalaki yung isang coin? Isang coin size? Kapang-kapa. Kapang-kapa.
Bukol.
Yeah, kapang-kapa. Madaling kapain.
Yes, Doc.
Okay. Sige. Kung santol, ganon. And then, anong measurement nakalagay dun sa ultrasound mo?
Ang nakalagay, sir, ay Doc, solid nodule in the right breast at the 10 o'clock position, 2 cm.
2 cm. Ayan, okay. 2 cm pa lang. Okay.
from the nipple measuring 5.46 by
Okay na,
5.26 by
yun ang bukol na kakapa mo, 2 cm sa ultrasound, di ba? Okay.
ayun.
May sinabi siyang well-defined border. Border.
Wala, Dok.
Wala. Okay. Border niya, well delineated, circumscribed. Ito yung mga terms na ginagamit nila.
Ang nakalagay dito, Dok, walang border, Dok.
Sige, okay lang yan kasi kumisan kulang yung mga report na yan. Kaya yan ang limitations, no? Kaya importante kakapain ko, no? Okay. So para to supplement, no? Okay. So pumunta ka na ba sa ibang doktor?
Hindi pa, Dok.
Bakit ka nagpa-ultrasound? Bakit may ultrasound ka? Wala kang doktor?
Nagpa-ultrasound ako. Pumunta ako sa doktor. Tapos, pina-request nila itong ultrasound at mammogram, Dok.
Nako, okay. Hindi ka, sinong doktor yon? Breast specialist?
Dok,
Kinapa ba yung breast mo?
ang nagkapa ng breast ko, Dok, yung assistant,
Doktor?
parang nurse siguro.
Okay. Anyway, nag-order.
Tapos,
Anyway, nag-order na.
Ay, ang nag-ultrasound sa akin, sir, si Dr. Teres sa Sir Sonoro.
Basta may kumapa sa iyo and then after kinapa ka, saka ka in-ultrasound and mamo. Ilang taon ka na?
54, Doc.
Okay, pinamamo ka in ultrasound, di ba? So yan ang results mo, no? Okay. So sinabi niyang fibroadenoma. Okay? So kung tama sila, benign siya. Okay? So importante, binalikan mo ba yung doktor mo? Binalikan mo rin yung
Binalikan ko, Doc.
Balikan mo
Yes,
yung doktor
Doc.
mo. Ano sabi niya?
Ang sabi ng doktor, pupunta daw ako, nirefer ako sa surgeon.
Hindi siya breast surgeon. Okay. Sige, punta ka sa breast surgeon, no? Okay. Kung may kilala ka, sa kanila. Kung hindi, punta ka sa akin, no? Sino
Sige.
nag-invite sa'yo rito sa Zoom
Sa
namin?
si Teresita Lopez.
Okay. So, sinabi sa'yo mag-attend ka rito.
Yes, Doc.
Okay, good. Sige. So, kung gusto mo sa akin, bigyan ko sa yung clinic hours ko mamaya, no? Ano mo lang ako, i-message mo lang ako, no? Para makita kita sa Tuesday.
Sige, Doc.
Okay? Importante makapa ko. Importante yung kapa ko. Okay? Pero sa ngayon,
sige, Doc.
huwag ka mo na matakot. Based on the report, mukhang hindi naman cancer. Okay? I-check ko lang. Ha? Okay?
Ay, ito naman sa monogram, nakalagay dito A4, Berads A4, Berads 4E.
May 4 pa. Sige. Itong 4, medyo...
Berads 4E is monogram. Sa monogram, ang nakalagay, low suspicious malignancy.
Hindi ba, sige, medyo magulo. Kailangan, tingnan na lang kita pag, okay? Pag-aralan ko mabuti. Okay?
Sige, Doc.
Okay.
Doc Ray, excuse po. Siya po yung test manual, yung sinabi ko po kanina.
Okay. Yun ang mo. Okay. So,
Opo.
punta na lang siya sa akin para makapa ako. Okay.
Thank you po, Doc.
Okay.
Doc.
Okay. Any more questions? Any more? Wala na? No more sharing. Doc Lance, anong comment mo? Lance.
Yun nga, yung ultrasound, operator dependent kasi siya. Kaya medyo may inconsistencies. Pero yung mammogram, usually wala yan kasi parang x-ray lang yan. Pero depende lang din yan sa nagbabasang radiologist kung ano yung interpretation nila. Minsan BI-RADS yun. Minsan BI-RADS 3, nagbabago-bago. Kaya parang importante talaga makita ng surgeon or ng doctor yung patient para ma-correlate lagi sa physical findings. Kaya laging may footnote yung mga reports nila, parang please correlate clinically. Parang hindi lang ito yung papagbasihan nyo na yung report kung ano yung gagawin. Kailangan mo-correlate with clinical findings. Tapos tingin ko yun talaga yung pinaka-important.
Okay? So the bottom line message here, tandaan ninyo, lahat ng statements from the doctor, from the x-ray, from the ultrasound are not final na final. No? So importante, huwag kayo magre-rely lang sa ultrasound report sa mamo. No? Okay, as I said, hindi siya final, kumisa may mga mali, may mga kulang. No? So importante, merong isang, I just call it clinicians, yung tumitingin ng pasyente. Kasi yung gumagawa ng ultrasound, mamo, doktor din sila, nagbabasa. Pero hindi sila tumitingin ng pasyente, no? Hindi siya gumagamot, no? Okay. So importante yung doctor tulad ko, saka si Dr. Lance, no, yung tumitingin ng pasyente, no, kakapain ka ng husto, and then pagkatapos isusuri namin yung ultrasound mo. Titingnan namin kung nagja-jibe, kung tumutugma, no? Okay? Pag hindi tumugma, mandududa kami. Baka mali siya o mali ako, gano'n, no? Okay? Then we will make a decision, no? We will advise you accordingly, no? Okay? So importante 'yon, ha? So, and then importante yung pangalawang lesson dito, yung follow-up. Importante yung follow-up, ha? Follow-up sa sarili niyo. When you say follow-up sa sarili niyo, imo-monitor pa rin yung sarili niyo. Okay? That's follow-up, no? Now, for the doctor's follow-up, pupunta kayo sa doctor, no? Siya nang bahala magsabi sa inyo na 2 months, 3 months. Kung sinabi niyang hindi na kayo babalik, kampante na ba kayo doon? Kung sinabi niya, huwag na kayo bumalik sa akin, kampante na kayo? Baka it's either, baka ayaw na sa inyo, huwag na kayong bumalik. Okay? So yung mga doktor, hindi dapat gano'n sasabihin sa iyo, magpa-check up, bumalik pa rin kayo, no? Para to make sure na tama, no? Okay. So, pero yung check up, huwag naman everyday magpapa-check up kayo, everyday kayo magbabayad, huwag naman noon, no? Kaya pwedeng 1 month, 2 months, depende. Titingnan niyo yung reasonable yung advice nila, no? Okay? Okay. So, if there are no more questions, we call it a day. Wala na? So, kung wala na, last call, wala na? Okay, we'll call it today. Next week, we will have a MAR on thyroid naman. I-alternate ko lang breast thyroid muna. Okay? Okay.
Thank you po, Doc. Thank you po.
Thank you po,
Bye-bye,
Dr.
Doc.
Ray.
Thank you
Have a
po.
nice
Thank you so
weekend.
much, Doc.